Good afternoon. I am Wendy Randall. I am one of the consultant midwives at the John Radcliffe Hospital, and I just thought that it would be really important today to touch base with you because we absolutely appreciate it is an incredibly stressful time for people who, well, in general, but especially people that are pregnant. So I thought I'd join you from home today to see if there are any particular questions you may have, and if I can do anything to help alleviate some of those concerns. For those of you who are part of this discussion, I wasn't in the first wave in sort of March, April. I was coming onto Facebook Live and answering questions on a weekly basis. And whilst in terms of capacity, because I'm very much working clinically just now as well, I can't perhaps manage weekly, I will be endeavouring to do Facebook Lives every 2 weeks and more frequently if it's needed. Obviously, if there is anything that you need help and advice with more urgently than when I'm doing one of the Facebook Lives, would encourage you to contact your community midwives. Obviously, there is the Maternity Assessment Unit is available at the John Radcliffe at the end of the phone, 24 hours a day, 7 days a week. But for more generic questions, your community midwife will answer them. And for emergency things, then that would be the Maternity Assessment Unit. I'm going to remove my glasses, sorry. I do not need those, only for reading. And I can't see any questions just now anyway, so I'll pop them back on if I need them. So the key messages, I mean, obviously the session that Brenda Kelly has just done on vaccines, the COVID vaccine and pregnancy, that will be saved and will be available on this Facebook Live, and we'll try to share that link more widely as well for people that perhaps aren't part of this group, but hopefully you can share the link with others if you're aware of other people who would benefit from hearing the information that Brenda shared. One of the questions that was raised within that session that I just wanted to reiterate are for those of you who do have the vaccine because of work or because your medical doctor who deals with whichever health risk category you're in recommends the vaccine, it is really important for them to document that you are pregnant because we will be forming a database as part of that. The other thing is, if you are over 24 weeks pregnant and you test positive for COVID, please can you contact your community midwife to let them know? Because again, there are certain things that we want to do to be able to make sure that you and the baby are safe moving forwards. It's less than 24 weeks, it isn't as relevant, but you can obviously tell your midwife when you see her next, but from 24 weeks onwards, it is something that we do need to be aware of because we might need to do some additional follow-up from you. So really importantly, not every pregnant woman who tests positive ends up having to be admitted to hospital because people experience a COVID infection in different ways. The majority of people can manage at home with regular paracetamol and just rest and rehydration. But if we are concerned and you do need some additional input, then obviously you'll be in hospital. And for those women, we will be able to follow up with them. What we really need the community midwives to know is if you're over 24 weeks pregnant and you have the infection, but you don't need to go into hospital for it. So please can you touch base with your community midwife if that applies to you. So the glasses are having to go on. Sarah, you're saying, should we be considering taking your son out of nursery and self-isolating before our due date? If so, and for how long? So, Sarah, we are not recommending that. It is the balance for those children and being able to be looked after in nursery for their sake, for their development, for you as well. Children are at very low risk of picking up the virus and spreading the virus. So at present, that isn't and hasn't been throughout the pandemic, something that we have been recommending. Lauren, you've said, can partners still attend the breech clinic? So Lauren, at present, we are still saying partners can attend the breech clinic. There are not that many women that come in, and because as part of the breech clinic, there's a lot of information for women to take on board, we feel it is beneficial for partners still to attend that. I mean, I think as Brenda was pointing out, this is an evolving picture. And, you know, and we may have to, depending on what infection levels look like, and we may have to respond to that. But there are lots of things that we're trying to safeguard at present, and at present, the breech clinic is still somewhere that a partner can attend. Please make sure that people are wearing masks. We have had issues with partners refusing to wear masks or not wanting to wear masks. We do need to try and keep everybody as safe as possible and still apply the principles to reduce spread of virus. So Laura, you're asking, are women being offered COVID testing during labour? If so, what would happen to someone who declined to be tested? So let's start with that. So, because there's a second part to your question. So Laura, yes, we do advocate testing women in labour. So women are offered what we call a lateral flow test, which means that we can get a result much quicker now. It gives us an idea of whether there is the potential for that person to be positive, and if that lateral flow test comes back positive, we then use the other swab testing to confirm that position. So that is being offered. We offer it because it helps us to try to keep women and partners and maternity staff as safe as possible. So I suppose if you think that if there is the potential for women to be positive, that it can be that babies can be affected when you are in labour. So we recommend birthing in hospital and continuous monitoring of baby's heart rate. So if you were planning to birth in a midwifery-led unit, or at home, or in the spires, etc., in a low-risk environment, and we found that you were COVID positive, we would be recommending birthing on the delivery suite with continuous monitoring so that we can just ensure that your baby is not being affected by the fact that you have that virus in your system. So for us, the benefits of doing the testing is to make sure that you and the baby are in the right place, having the right monitoring so that we can have the safest outcome for you and your baby. If you choose to decline that test, of course that's your right. We can't make you have it because obviously the test does have there is a pathway that we would recommend following afterwards. So for women who perhaps would like to birth at home and they have the test and it's found that they are positive, for some women that can be quite devastating because they'd planned a home birth and that's what they would like to do. And so people don't then want to have the test because they wouldn't want to follow the advice. And again, that is something that you can make the informed decision to do, but it wouldn't be something that we recommend because we couldn't guarantee, you're now not low risk if we know that you have an active infection. The other consideration is from our staff perspective. It is if we know that women are COVID positive, we have an extra level of protective clothing, masks, etc. that we wear to keep our staff as safe as possible and to reduce the chance of infection. And that involves a specific way of putting on the protective equipment and taking it off, which is very difficult to do in a home environment. And also in a home environment, the amount of surface and spread issues there are in that environment, and even in terms of hand washing, can put that member of staff at risk. So it's much more advisable for that to be in a clinical situation, which is why home birth then wouldn't be the right place for you or for our staff. Because there is that extra level of protective equipment that we make, because we have a strain of virus that seems to be being passed on much more easily, that's why we feel it's really important for us to test women to see if the virus is present. So I hope that answers the first part of your question. You've also said, what proportion of OU midwives have now been vaccinated against COVID, please? Laura, we are sending people every day for vaccinations. I can't tell you exactly in what percentage, and it would change as well because we have people being vaccinated on a daily basis. We also have a list of people when slots become available that we can signpost midwives to go and get their vaccine. So we have midwives, doctors, etc. that are at, who may be on days off, who have put their names and phone numbers on a list so that they can be vaccinated as soon as a slot becomes available. So I think, there are so many different clinics now, and luckily we have the Oxford and the Pfizer vaccines, so we have two options to be able to vaccinate our staff, and we're doing everything we can. The Trust priority is to make sure that all staff are vaccinated, not just midwives. It's about, our portering team, our domestics that help with cleaning rooms, our staff that help serve meals in the unit. I'm trying to tell my daughter to be quiet in the background here. I do apologise. So it is that proportion of we're trying to make sure as many staff as possible get vaccinated, but staff are absolutely coming forward at the first opportunity they can, and they will be vaccinated. So I think there's a few more questions come up. So Abby is saying, are we still allowed one person with us at all scans? So Abby, there was a post I did about 10 days ago now, I think, and there is a link for that on, again, this Facebook page that can be shared. But we are only in a place just now that partners can attend for a 12-week and 20-week scan. There are, even the fetal medicine unit scans, it's not guaranteed. And so people will be individually contacted if there is an option for partners to attend. But we've had to greatly reduce the footfall through the unit. So I'm afraid, apart from a few exceptional situations, it is just the 12 and 20-week scan at present that partners can attend. Caitlin, it says, what are the visitation rules for parents if their baby is born and is in need of the special care baby unit? I'm really sorry. I think I was asked this about 10 days ago and I said I'd get an answer, and I haven't. But I absolutely promise I will contact the neonatal unit today and ask them what their current status is. Because we are different departments, although we obviously work very closely together, I don't have that up-to-date information. But I will make note to self quickly now and make sure that we post it. Apologies, that we post it this afternoon, Caitlin, to answer your questions. I think there has been some information going about on various websites about people who are COVID positive being separated from their baby. And I just wanted to comment that the only time I can think that that would be an option is if that woman was unwell and had a COVID infection, because we obviously the babies in the neonatal unit are very vulnerable, and it's really important again to keep the staff on duty there to make sure that there's enough staff to look after the babies. So it can be incredibly difficult for us when somebody is COVID positive to enable them to be with their baby on the neonatal unit. And that is very, very hard for people to not have that contact when they've had a baby. But I think when people have been posting things on social media, and I think it's been nationally, it's about people saying, I was separated from my baby. It is about us, trying to make sure that we don't put other people's babies at risk, because these babies are not, whilst they've put lots of measures in place to keep it as safe as possible, it is about, trying to keep the spread of infection from other babies in the neonatal unit and the staff. But I promise I'll get the answer for you, Caitlin, and sorry I don't have it just now. Bernadette, you said at what stage are partners allowed in birth? Is it as soon as you attend hospital or active labour? So Bernadette, again, I think the message that I did a few weeks ago, if you want to go back and look at that in more detail, but we recommend that they're with you from the point that you feel that you're in labour. so it isn't necessarily from active labour. The only time it's different is if you have to be admitted in early labour to our antenatal ward. Unfortunately, partners can't attend that. But when you go into a birth environment, whether it's one of our midwifery-led units or delivery suite, when you come into hospital or you call the midwife, that's at the point that your partner would attend. And as a very rough guide, they can stay about 2 hours after the birth. But Bernadette, please do look at the post I did before, because I think it might answer your question in more detail. Katie, you said you're type 1 diabetic. If you had the first part of the vaccine and then fell pregnant, is it likely that I wouldn't be offered the second part of the vaccine? No, Katie, that wasn't the message that I got from what Brenda said earlier, but it may be worth you re-listening to that. And if we haven't answered your question again, in that film, then we will answer it. But, I think, regardless, one part of the vaccine they feel is preferable than none anyway. But again, I think that'd be a decision that we could have if that were to happen. Kaylee, you've asked, what is the induction process like at the moment? So the induction process at the minute is much like, again, I think there's a film recorded on this Facebook site about the induction process where you can meet our team. And we're working on a more involved film at the minute that hopefully we'll be able to share with people in the next, hopefully 3 to 4 months. But the induction process is women are given a date. So imagine you were given the date of, say you were given tomorrow as your date for induction. You would come in today at a set time to, they will discuss the process with you, explain what will happen. If you go ahead, we monitor the baby. We examine you. If your cervix is less than 3 centimetres, we put a catheter in your cervix with a balloon which helps to soften and open it up. If the cervix is more than 3 centimetres, we give you a stretch and sweep, and we wouldn't continue the induction until tomorrow, which is when your date was. And then tomorrow you would come in and at a convenient time you would have your waters broken, and the induction would continue if you didn't go into labour from there yourself. In terms of partners, unfortunately, because the induction happens on the antenatal ward, you can't come in with your partners at present, but we do have obviously our midwife and our maternity support worker there who are amazing and very supportive people. And they will obviously support you during that time, and you can put your partner on speakerphone if they want to be present from outside. And then, if you are an outpatient induction, you would go home hopefully within about an hour of being in the hospital, and you would return the following day. But if you obviously stay as an inpatient, you'd then go on to our antenatal ward. It's a different bay. When you come in the following day for induction, again, your partner can't come in with you to begin with, because it's not a guarantee that you'd come in, have the monitor and have your waters broken within a short period of time, because it depends on how many women are in labour in the rest of the unit. So we do say, be prepared that sometimes there can be a wait. So we do say to partners, unfortunately you can't come in at that point, but when we know that you are going to either the Spires or delivery suite, depending on the next step of the induction process, that is when you get to the birth environment, your partner would come in and join you then. So I hope that helps. And again, Kaylee, just in terms of how much time afterwards, your partner's generally with you for around 2 hours after the birth. Sometimes it's a bit longer. It's not normally shorter than that. So generally you get a couple of hours before they leave. But it's different depending on different situations and depending on where you go after you've birthed your baby. So Faith, you are 36 and 5 days pregnant and you have gestational diabetes. If you were to go into labour naturally, I'm aware I would need the extra monitoring for the baby. Does this mean I'd need to be admitted to the ward before being 4 centimetres dilated? So, Faith, if you're gestational diabetes and you are managing that on diet, you can obviously choose where you birth your baby because it doesn't mean that you need extra monitoring. If you need metformin or insulin, then your diabetic team will advise you on going to the delivery suite. No, it doesn't mean that you need to be admitted before 4 centimetres dilated. We would still recommend that when you go into natural labour that you attend when you're having regular contractions. So please don't think that you have to come in any earlier. And your partner would be with you. So you can manage the first bit of labour at home. It's called the latent phase, when the contractions may be irregular, some stronger than others, some lasting longer than others, etc. And it isn't until those become regular that that's the right time to come in. So your partner would be with you for that period of time at home, and then when you talk to the midwives on the phone and they say, yes, this is when we'd like to see you, it's at that point that your partner accompanies you and comes in with you. Very occasionally, if our maternity assessment unit is very busy and we can't maintain social distancing in our waiting room, we may ask you and your partner to wait outside and we can call you so that you can come in together, or your partner may choose to stay outside and you stay in our waiting room and he comes in and joins you when you have your labour assessment. We have to try and keep the social distancing going, but we also want to try to keep you with your partner as much as possible. So hopefully I've answered that, Faith. But do talk to your midwife about sort of plans, and do talk to your diabetic team, because you know we want to keep things as normal as we can, and we want to still give women options. But do explore that with us, because we want to enable you to have you know, the kind of birth that you would like. Emily says, do partners have to wear masks during the birth? Yes, Emily, we would ask partners to wear masks when there is a healthcare professional in the room with them. If you are, you know, at a time when a midwife may be on a break or have gone to get something, your partner can remove their mask and you know, have you can have a nice kiss and cuddle if you like. But when the midwife or maternity support worker or doctor, whoever is in the room, we ask your partner to wear their mask. So Tammy said, hello, what does the lateral flow test involve? Super nervous about things being poked up your nose and down your throat whilst in labour. So Tammy, the lateral flow is it is a very, very fine swab, very, very fine, and it does go in your nose. We appreciate it is really not very nice. We have to have it twice a week, so we're fully aware. You know, I hope you'll find that reassuring that all people that work in the hospital have to have their lateral flow test as well. So it does tickle a bit. It does go into the back of your nose. It doesn't go down your throat. And we don't put anything in your mouth unless we do the other swab. But the lateral flow test, very fine, goes into your nose, and it's 10 seconds each side. It can bring tears to your eyes. It can make your nose stream, can make you sneeze. We obviously don't do it when you're having a contraction, so we do it in between, and we are as gentle as we can be. But there are many people that don't like it, and he'll kill me for saying so. But my husband didn't like it when he had his either. You know, it's uncomfortable, it's not pleasant, but it's the best way that we have of knowing, you know, or giving us a guide as to whether we should do further tests on you. If we do have to do further tests, we put a swab in your nose, well, we put it in your mouth first, and then we put it in your nose. So that one tickles your tonsils as well as tickling your nose. But, you know, we are sorry about it, it's not terribly pleasant. But we try to do it at a point in labour that you know, is not when you're having a contraction. So Ashley, you said, are you still supposed to have a growth scan if you've had COVID 2 weeks before your due date? So Ashley, in terms of, I think the really important thing for us at the minute is that this is an evolving picture. So what will happen is, if people have had COVID more than 24 weeks pregnant, so you're over 24 weeks pregnant and you've had COVID, please talk to your community midwife, and your community midwife will talk to our scan department And there might be other things that we need to take into consideration. So they'll talk to the obstetrician about what are the next steps for you in terms of looking after you. Just make sure that your midwife knows. I mean, if you've been in hospital, we will know and we will have sorted out a path of treatment for you. But if you haven't been in hospital with it, your midwife needs to know so that they can talk to the obstetrician. Carly Marie, you've asked, if someone refuses to be tested, are they kept away from people who have tested negative? So Carly, we don't have a separate bay, etc., for them to be in. I think that's why, we feel we would like to offer it to everyone to have it, and hope that people do see that there is a value in having it and will choose to have it. Because I appreciate people who've already tested negative don't want to be exposed to somebody who could potentially be positive. So it is about, when you're making that decision about being tested or not, please do try to think about the bigger picture of what the impact would be on yourself and others, depending on that result. You've asked, can I still have an active labour even if there is a need of induction due to overdue baby? Yes, we still try to, our really important thing is to try to enable women to be as upright and mobile as they come and to still have options. So some people need very little input from us to encourage labour as part of induction, and other people need much more involvement in terms of inducing labour. But, we have a birthing pole on our delivery suite. We have wireless and waterproof monitoring to enable people to use the birthing pole, even if they need continuous monitoring of the baby's heart rate. We have lots of aids. We have balls, bean bags, birthing stools, etc. So there are all options there for people, should they want them. Catherine, you said some other trusts in the UK, IVF pregnancies consultant-led. Is that the case in Oxfordshire? So, Catherine, in terms of IVF, what we do is, so IVF has traditionally been consultant-led in Oxford, and that was more about screening for preeclampsia and growth issues. That has, because we do that now with our growth scan pathway, it's less compulsory for people to have medical-led care. Just because of IVF, and it doesn't really change any of our other management and labour. So some people do still stay with their midwife. In terms of birthing your baby, it doesn't impact where you birth your baby. If you don't have any other issues with you or the baby, women who have an IVF conceived pregnancy can birth at home or in a midwifery-led unit or on delivery suite. We try to promote choice and options and making those shared decisions with you. Thank you for people that are saying thank you, and especially the beautiful comments that were posted when Brenda was speaking as well. It's really nice to hear the positive stuff. We are working as hard as we can under ever-changing situations. So please don't feel that we're trying to be cruel. In any of the things that I'm discussing today, we're not making these changes because we're making them because we feel there's value to making them, and we appreciate that it can be very upsetting for people. So Tammy, you said that you're 40 weeks and 1 day and currently quite stressed. I think, Tammy, if you're feeling stressed, please talk to your midwife. They are absolutely there to provide support, and we appreciate it's difficult. Some of your contact with your midwife has been over the phone. If you're struggling to talk to your own community midwife, then please do contact our maternity assessment unit and see how they can help you. We also have the Maternity Assessment Centre at the Horton in Banbury, which again, Monday to Friday, sort of 9 to 5, there's somebody there that you can talk to. But please don't be worrying and being stressed at home. Do reach out for people, and we'll try to support you and signpost you as much as possible. Samantha, you said with the induction process, I know that unless you're 3 centimetres, you generally have the full load, but if you're more than 3 centimetres, it's breaking waters. If you are 2 centimetres, say, could you request for waters breaking instead? Samantha, yes, you could, if you don't want to have the catheter put in, but we wouldn't do it on that day. So if you were given the date of the 16th of January and the day of the 15th is when you would come in for the Foleys, but you would prefer to have your waters broken, we wouldn't break your waters until the 16th, because that's the day that we're planning to have you in labour. So I hope that makes sense. Emily, you're saying, am I right in thinking that you can test yourself? I think, Emily, if you are a healthcare professional and you've had training in terms of doing the lateral flow test, then yes. But we tend to find that in terms of doing the lateral flow test, it's better for somebody who's been trained to do it, because otherwise people are reluctant to put it in the right place to do the test. Emily, you said, just another question, would you advise expectant mothers to shield before their due date, and if so, from what week? Emily, we're not advising you to shield per se, we're asking you to follow the government advice in terms of, covering your face, space, hand washing, all of those things, to keep you as safe as possible. And the added caveat we tend to say to people is try, if possible, try not to be the one that does the supermarket shopping. Try to get your partner to do it, to have shopping delivered, whatever works better for you. So it's just about trying to keep yourself in an environment that you're at less risk of contracting things, but we're not telling you to sort of put yourself in a bubble where you're completely shielding. So Maya, you're saying, for example, you went to the hospital and you're 1 centimetres or 3 centimetres. Are you going to send the pregnant woman back to her home even if she lives far away and no car, because you're worried about your case? Also, cervix dilation is not progressing or slow. Are you offering Pitocin drip? So Maya, what we try to do on the phone, when you phone the midwife, if it's a community birth, if you're phoning maternity assessment unit or your Spires, is we're trying to get a history of what's happened, because the majority of women, the majority of evidence base shows that women are much better in the latent phase of labour in their own environment. So the most crucial thing for us is to try to triage you as best we can, so that we can say, actually, now is the right time to come to hospital, or you've got a bit longer, you can stay at home. Now, sometimes we invite people in and it's too early, but that's important for that woman. Or we think that she might be more advanced, and when you get in, things have quietened down and slowed down again. And so in those situations, we'd very much be talking to you about the benefits of being home and what that means. And we take into consideration the kind of things that you've raised in terms of not having a car, living far away, etc. And Maya, we do tend to say to people, if you live far away and you live near a midwifery-led unit, such as Wallingford or Wantage or Banbury or the Cotswold Maternity Unit, it may be better for you to go there if you're low risk to begin with, to have an assessment to see actually how are things going. So there's always that option, but we try to have conversations with you and make decisions with you about what is better for you, so it's more individualized. So it's really difficult to say this is exactly what would happen. They would obviously very much consider what would for your individual circumstances, what would be the better option for you. In terms of Pitocin, we use oxytocin, and yes, if labour is slow, we will consider whether oxytocin would be beneficial or not to you to help with the progress of labour. But again, there are so many things that we take into consideration when thinking whether we use that hormone or not. So that's very much a discussion that the team helping to look after you would advise you on. Kim, you're asking, does the Spires have a TENS machine and birthing ball which we can use during labour, or do we have to bring your own? So Kim, unfortunately we don't have any TENS machines on the Spires, so if you do want a TENS machine, please do bring one in with you. But otherwise we have birthing balls, mats, beanbags, birthing stools. We have one of these cool active birth couches as well. So there's different options available to you when you come in, but we don't actually have a TENS machine. So thank you again for all your thank yous. and for us to stay safe, and we hope that you will stay safe as well. I'm going to end today, if that's all right. I think the team, I have to thank Oxfordshire Maternity Voices Partnership. This is a user group who are spending predominantly their own time helping to liaise with us to try to get the best outcomes for everyone and make sure your voices are heard. So really grateful to talk to you today, and they will have the plan for when I'm going to talk with you again, which I think is about a week on Monday or something. In the interim, if you have any questions, please post them and we will try and answer them. Otherwise, you stay safe too, and we look forward to looking after you.